Hello everyone, I'm Jim Longworth and welcome to another edition of Forsyth County Connections, coming to you from the studios and the hospitality of Cable 2, the Winston-Salem Forsyth County School System. We appreciate their letting us be here in their studio, and we hope you'll stay with us for the whole half hour. We have some great guests and important information coming your way, including things like keeping cool during the summer for folks that need some heat relief. Lots of things we'll talk about, but where we want to start is with a summer feeding program I want to learn about. We're going to do that with an expert in the field. Jessica Hunter is Income Maintenance Supervisor for the Forsyth County Department of Social Services. Welcome to the show.
Thank you for having me.
Graduate of UNC Charlotte,
yes.
as is every member of your family. So there's about 80 of you that's gone to UNC Charlotte.
Yes, the next one should be free.
Let me ask you, how much of a significant need is there in the county for food assistance? How bad a problem do we have to where we really need some assistance?
So in a study that was done back in 2019, Winston-Salem ranked number 7 on the list for counties who had a high hardship for food insecurities. So for a national study to be ranked number 7 on that list, that lets you know there are a lot of people in our community who have a hard time obtaining healthy food. People
find that surprising, just like the food insecurity issues with kids and everything. And people, oh, you're the city of the arts. You got the county's got this and that, and we still have problems. What's the purpose of the summer feeding program specifically?
The purpose of that program is to ensure or to aid in families, low-income families, obtaining healthy and nutritional food for their children while they're out of school. So you have a lot of families who the school food lunch program that they have, that's their main time that they're receiving at least one healthy, or maybe 2 if they receive breakfast.
But in the summer, that's gone.
But in the summertime, that's gone because school is closed.
Well, now, how exactly are people getting the food in this summer feeding program? How does that work?
So they have a couple options. There's one program that's been going on since 2020 with COVID-19 pandemic. It's called the PEBT, or Pandemic Electronic Benefits Program.
Okay.
So it was for families who may not receive regular food and nutrition benefits, but who depended on that meal that their children would receive at school. So once the schools closed down, the PEBT program was put in place to allow families to have funds to still be able to go to the store and obtain food for their children.
Yeah, because food is not cheap.
It's not.
And if you've been counting on the kids going to school and getting that, now you got to budget.
You've got to budget extra meals in.
Well, now, how would you determine who exactly would be eligible for the PEBT money? Because, of course, we're coming out of the pandemic now, but the program's still in place. How do you determine who's eligible?
So that program is administered through the North Carolina Department of Health and Human Services, along with the North Carolina Department of Public Instruction, or the school system as people know them as.
Right.
So basically what they would do is they would look to see who may have been eligible for free or reduced lunch with the school system, and they were automatically eligible for PEBT. So they look at that, they look to see if they're attending as a traditional in-person child or student. Then they also look to see if you have children who are in child care and are eligible for those programs, or those who were attending home or virtual school, they may be eligible as well.
Well, let me ask you about when this ends, and I guess it's a stupid question, but I'm assuming if it's a summer type thing, you get to about August or September and then it's over, or what?
So they did offer it during the school year, but the school year benefits will end, or they actually ended on May the 11th. So the summer issuance will start this month and run through the beginning of July. After those issuances in July are done, then that will be the end of that PEBT program.
Now, how would somebody apply? I mean, is there a certain website or something? Or
they would no longer be able to apply for the PEBT program, but they can apply for regular food and nutrition benefits. They can come to the Forsyth County Department of Social Services Monday through Friday, 8 to 5. They can go online to EPASS, and that's EPASS. .nc.gov. They can also give our offices a call so we can try to mail them an application or complete one over the phone.
And then if they're thinking ahead to next summer, is this going to be available next summer too?
No, it will not. Once the public health emergency ended, that was the end of that PEBT program. But that's why we're trying to make sure everyone knows about regular food and nutrition benefits. There are other organizations in the city of Winston-Salem, like Hope of Winston-Salem, Second Harvest Food Banks, senior services, even for our aging community.
That's right.
And then the Forsyth County school system will offer summer feeding programs as well.
Absolutely. Jessica Hunter, I appreciate what you're doing for so many people and having you here. I hope you come back sometime.
Thank you so much.
All right. We'll be right back after this.
Help emergency responders help you when you can't help yourself. Forsyth Cares. Forsyth Cares, the Community Assistance Registry for Emergency Services, allows you to register yourself or someone in your household sharing health conditions or information that might aid in your care should your home be the subject of a 911 call.
911, what's your emergency?
Operators will see critical information, medications, conditions, or in the case of a wandering child or an adult with cognitive disabilities, places they like to go, or even if they have access to a vehicle. The information is stored in a database only accessible to first responders and 911 agents. Get more information at forsyth.cc/Forsyth Cares. In the moment that your life depends on a fast response, get information to first responders that can aid in your or your loved one's care. That's forsyth.cc/Forsyth Cares.
Back now on this edition of Forsyth County Connections, we want to talk about a serious topic here for the next few minutes. We want to talk about sexually transmitted infections and preventing them and dealing with them. And we have an expert in the field who's studied public health and been in this career for a while. Jasmine Harris is a certified health education specialist with the county, Forsyth County's Department of Public Health. Thanks so much for being here.
Thank you for having me.
How are sexually transmitted infections transmitted?
They're transmitted through sex primarily, vaginal, anal, and oral sex. So they're transmitted through having sex with someone who is infected with the STI.
Now, give me a couple examples just so people know. What are some of the common STIs that you deal with?
Absolutely. Between the ages of 13 and 64, STIs are common. Are gonorrhea, chlamydia, syphilis, and HIV are the common STIs.
Now, as you and I were talking off camera a few minutes ago, I'm going to say in the old days, the HIV virus was, in your words, and I think it was correct, it's considered for a lot of people a death sentence, and things have changed and there's been treatment. So now why is it still important for people to get tested for HIV?
It's important for people to get tested just because you don't know you have an STI until you get tested. That's the only way to be certain that you have an STI. And HIV has always carried a negative stigma in the community. So educating the community on there's so many options to live a longer, healthy life with STIs.
Is that negative thing, is it changing a little bit for the better since you've been here in the county for about 9 months, but you've been working in this field before? Are things beginning to change with the way people look at somebody when they got HIV, or how is it?
We're making some progression in that area. You cannot get HIV from just shaking someone's hand. So we still have to kind of correct ourselves in the community when we approach those people. But just educating them that there is options like PrEP and PEP, which are medications to prevent HIV.
Yeah.
So the more that they know, the more we can kind of progress in that area.
So, I mean, is that some of the difficulties if you have HIV that you have to live with some of the people that have the wrong information or the stigma about it, or what are the difficulties in living with HIV?
Persons living with HIV, they do experience a lot of stigma going out into the community, continuing their lives. So a lot of people don't want to interact with them because they know they have the disease. But if you're in ongoing and continuous care, you can live healthy lives.
You said in an email to me there's something called a POSSE program. What is that?
So POSSE is an outreach program at the health department. We go out in the most convenient way in a mobile unit to get people tested to know their status. So we go out in that mobile unit, we give them condoms, we give them education, and we are able to test them on site. No matter if we're in an apartment complex, in Food Line parking lot, we can test them anywhere. We go to them.
Now, this might be getting a little too specific, but when you say you're going out and you're helping people and educating them, giving out condoms, that kind of thing, do you have to be a certain age to be able to get these things? Or?
Yes, you have to be at least 13 to get tested, and we do not communicate with parents if they are 13. They're at legal age to give consent. So 13.
I understand. 13 is now the okay. Mm-hmm. Now, legal aids for information, so that you don't, for information sharing. I understand what you're saying. Now, do you have any special events that Posse does or puts on for people? Because I know you're into educating people. Any events that people should know about?
Yes, so we are regularly testing in the clinics around Winston-Salem. Upcoming, we have a few Pride Center events. So Pride Festival in Downtown Arts District is on June 24th. We also are partnering with North Star, which is on Burke Street, and we're going to do a PrEP and MPOX education session with them. And then we're also going to participate in National HIV Testing Day at Walgreens on the 27th.
June 27th,
June
National
27th.
Testing Day.
Yes, National HIV Testing Day.
Now, what's the best way for people to contact the Posse team?
The Posse team, we are on all social media platforms at Posse Health. And then we can also be reached at 336-703-3199.
I'm going to have you say that number again. I write slow. 703-3199?
Yes, sir.
Okay. Well, I tell you what, Jasmine, you just really do so much for the community, and I appreciate you taking time. I know you're busy, but thanks for taking time to stop by and tell us about it.
Thank you.
All right. We'll be right back after this.
Emergencies happen. Every home needs an emergency kit. Are you ready? Start with a large suitcase. They're mobile. For safety and security, pack extra clothes, matches inside a waterproof container, a first aid kit and manual, flashlight, and battery-powered radio and extra batteries. For nutrition, your kit should contain a 3-day supply of non-perishable food, kitchen utensils like a manual can opener. For hygiene, pack hand sanitizer, soap, bleach, and toilet paper. For financial matters, have these important documents: photocopies of identification, insurance policies, credit cards, cash and coins. For health, prescription medications, glasses and hearing aids. For your mental health, consider a simple board game. Your kid should match your family. It may be different if you have an infant, seniors, or pets. It may even vary from one season to the next. Update the kit whenever we roll the clocks forward in the spring and back in the fall. You can see other examples of what you may want in the kit at readyforsyth.org. Follow us on Facebook and Twitter at readyforsyth.
Back now on Forsyth County Connections, and I'm fascinated about this next topic because I think it's such a great program. We want to talk about something called Operation Fan Heat Relief, a timely thing to talk about, and we do it with a great gentleman who does a lot of good for the folks in the county. Rick Hall's Director of the Adult Services Division for Forsyth County Department of Social Services. Welcome to the program.
Thank you.
Now, what is this Operation Fan Heat Relief, and why was it needed?
Well, Operation Fan Heat Release has been in existence since 1986. It's a program which is operational during the summer to help adults who are vulnerable to heat-related illnesses. In fact, since 1986, various energy providers across North Carolina have contributed funds through the Department of Health and Human Services to local area agencies on aging, and Forsyth County Department of Social Services serves as a local provider by which fans can be provided through this program to help those in need.
In the summer months when it really gets hot.
That's correct.
Now, how does this help our community in general, do you think?
Well, as folks age, they become more susceptible to and less able to differentiate temperature changes. In addition to that, many of them are taking medications which make them more susceptible to heat-related illnesses.
Right.
And in fact, dehydration is a big problem for adults as they age. Of course, this can be aggravated during the summer. So these fans provide a very cost-effective way and a very simple way to help folks be cooler during the summer and maybe help to prevent some of those heat-related illnesses.
Rick, who exactly is eligible to receive a fan?
It's a good question, and it's 3 simple criteria. One is you need to be an adult that is 60 years of age or older, or an adult who is disabled. You need to be a Forsyth County resident, and you need to have a situation in your home which makes you particularly vulnerable to heat-related illnesses.
Like no air conditioning?
No air conditioning, exactly.
How can I obtain a fan if I'm eligible?
We try to make it as easy as possible for you at Forsyth County DSS. So if you'd like, you can come into our agency if that's the most convenient way for you. You could also call. You can call the Adult Services Division, and you can call us at 336-703-3501.
Say that again.
That is 336-703-3501. 3501.
And you can tell them on the phone if they're eligible, if they give you the right information.
What you'll typically do is you'll make an application first of all, and then one of our trained social workers will recontact you unless you're speaking with one of them initially.
And of
then
course,
they'll
if this
talk
is
you
a
through
summer program, I'm assuming you're talking about a certain number of months, and then after that, the deadline's over, or what?
Actually, we will continue to maintain this program for as long as the supplies last.
Really?
So it is important for folks to call if they feel like they have a need right now, because we do have limited supplies of the fans.
Well, I was going to ask you, now, is there a fee to receive the fan at all?
There is not. In fact, those contributions that I mentioned earlier from the energy providers are what makes this possible for us to receive these fans free of charge.
I know that in some county governments, whatever, there are things that are loaned out, but in this case, they don't have to give the fan back, do they?
They sure don't. It's theirs to keep. They can use it year-round. In fact, if that fan breaks during the year and we start it again next year, they can receive another fan this year.
Now, you said an important word there. You said if we start it again. Is there no guarantee that this will be there, that the fans will be there next year, or what?
It's a program which is not necessarily guaranteed to be there, but it's been in existence since 1986 and continues to serve our constituents. And so we don't anticipate that it'll go away, but we certainly are pleased that it's here again this year.
We didn't rehearse this, but when you and I were talking off camera before we started and just sort of getting to know each other, you said something to me about what's gratifying to you and why you're in this position. Tell me that.
Well, there's so many people out there who are vulnerable, and we typically think of children, it comes to our mind because they are among our population, some of those who we just automatically identify as not able to take care of themselves. But all of us, as we age, will continue to experience these challenges, which we didn't as we were younger. Therefore, if all of us live long enough, we're going to reach a point where we face challenges where we can't supply all of our needs and maybe meet all of our needs. And so the Adult Services Division at Forsyth County DSS is a team which stands at the ready to help folks when they meet that need, or perhaps they're providers or family that are having questions about how they can help those aging adults meet their needs or overcome challenges. And really what we like to say most often is that we like to help adults age in place. Folks don't want to be prematurely placed or lose their independence. And so all of our programs, including Operation Fan Heat Relief, is designed to help people age in place, make determinations about what they want, and stay as independent as possible for as long as possible.
Well, God bless you for what you do. It's a great thing you're doing for so many people. And I know a minute ago you said 703-3501 is a good number for people to call on this particular initiative with getting the fan. Rick, thanks for everything.
Sure thing.
Hope you come back sometime.
We'll be glad to. Thank you.
We'll be right back after this.
Don't procrastinate. Vaccinate. School immunizations are available right now at Forsyth County Department of Public Health. Make sure your child is prepared for next school year by getting their immunizations now. Immunizations are available at no charge for Medicaid and uninsured patients. Call 336-703-3324 to schedule an appointment. For more information, visit forsyth.cc/public health. Forsyth County Department of Public Health. Promoting health. Improving lives.
Back now on Forsyth County Connections, and I'm sure if you keep up with the news, you've heard this Medicaid expansion term thrown around. And looks like we're really going to have it. It's really going to happen. So we're bringing in an expert to help me understand about it. Marissa Adams is Division Director of Medicaid Services for Forsyth County's Department of Social Services. Thanks for dropping by.
Thanks for having me, Jim.
We were talking off camera before we started just chit-chatting about people interchange and confuse the terms Medicare and Medicaid, don't they?
All the time. Medicare and Medicaid are two distinct programs. However, an individual can be both Medicaid and Medicare eligible.
Because Medicare, once you turn 65, that's an age-related thing.
It is.
But Medicaid is not necessarily an age-related.
It is not.
Because isn't it based more on income level and whether or not you can receive certain assistance?
It's based upon income level, whether you have children in your household, whether you are classified as blind, aged, or disabled. We cover pregnant women. As I stated, we even cover Medicare Part B premiums. So
Right.
that's how you can have that dual eligibility.
There's so much it seems you have to know, though, to try to figure out if you're qualified. And is that something that you get a lot of questions on? If somebody calling and saying, now, am I qualified for Medicaid? Or do you get those kind of questions?
every day, all the time.
Do people have to call you or come down to an office, or how do I find out if I'm eligible?
Well, there are several ways to apply or find out information about Medicaid. You can come in person at 741 North Highland Avenue. You can apply online at www.epass.nc.gov.
Okay.
We do phone application. We do have a Medicaid call center where you could call 703-3800 to find out information about what is needed to apply. But there are 3 basic criteria, which include being a North Carolina state resident, being a citizen or legal authorized, being a citizen
in the county, right?
or legal resident, and you must meet specified guidelines.
All right, now let me ask you this. The term that I kicked around a few minutes ago, and it's been in politics, and I hate politics about when it gets into these kind of things. I know you do too, but Medicaid expansion. As that happens, what does this mean for current recipients?
There will be no change for current recipients. What Medicaid expansion is speaking of is the addition of what we call those people that were in the gap coverage loss, those individuals from 19 to 64 that did not have children, they weren't age abled or blind, so therefore they didn't meet the qualifications to qualify for Medicaid.
And now they will.
Now they will, with the passing of House Bill 76 that now opens up the eligibility rosters to those individuals.
What does all this mean, Marissa, for the county, for the greater Winston-Salem area? It's good news for everybody, isn't it?
It's excellent news for everyone. With that, those individuals will get that much needed access to healthcare, whole person care, because Medicaid now has what's called managed care. So we just don't treat the physical, we treat the mental, the well-being, emotional and well-being, and other aspects of that everyday health.
And trying to be preventative and proactive and that kind of thing. Before time runs out, let me ask you now, let's say somebody continues to slip through the cracks because maybe they don't quite qualify. Are there any resources available for folks in that situation?
Yes, sir, they are. You always can go to the Forsyth County Public Health Department. They do have a sliding scale for a number of services. And we have 2 wonderful nonprofit health centers, the Community Care Center of Forsyth and the United Health Centers.
And they can help people.
They can help those that are uninsured.
Well, I just think it's great that we have this, that the expansion has finally come about. We were holding our breath on it. It's finally coming about, and it's going to mean a lot to a lot extra people that needed that help. Marissa, thanks so much for keeping up with all this, and I hope you'll come back and update us sometime.
Absolutely, my pleasure.
Thanks for all you do.
Thank you.
We'll be right back after this.
Every year, 4.5 million young adults between the ages of 18 and 24 visit the ER.
It's every parent's nightmare.
Umergency gives you all the tools you need to quickly and effectively manage your family's emergency. Umergency provides instant access to vital resources, customized to your student's campus and local community, digital consent form, and built-in urgent alert button. Umergency gives you peace of mind when you need it most. Download your Umergency app now.
Forsyth County Commissioners approved the 2023-2024 budget in June. It finishes out $569.6 million without a property tax increase, but with some improvements in key areas. Here's a look at some of the highlights. As mentioned, the tax rate remains the same, 67.78 cents per $100 of property value. Education is the largest service area in the expenditures at $182.2 million. That's 32% of the general fund budget. The school budget saw an increase of 4.5% or $7.2 million over last year's budget. A $1 million budget reserve was created for raises for classified school employees like bus drivers and food service staff. Public safety received $97.9 million. The Sheriff's Office received 71% of those funds, or $69.6 million. And Emergency Services received 27%, or $26 million. The Sheriff's Office budget includes $116,000 to hire and equip a special victims investigator who will investigate sexual assault cases, and $116,000 to hire and equip a cyber crime investigator. An additional deputy for Rural Hall was approved at $162,000, though $121,000 of that will come from the town of Rural Hall and forfeiture funds to provide the equipment. Another $100,000 to expand the Sheriff's Office's use of drones was approved. It includes $39,000 for temporary staff to help with concealed carry permits and fingerprinting, as well as $22,000 to convert an unsworn animal care officer to a sworn deputy position. On the emergency services portion of the public safety budget, $236,000 is in place for 2 shift supervisors and an emergency response vehicle. $103,000 is in place for 2 equipment technicians. It includes 8 advanced emergency medical technicians and a new ambulance. That effort will cost $703,000. Social Services also sees new spending in this budget, $106,000 for a senior social worker program manager and nearly $85,000 for a senior social worker for Child Protective Services, $74,000 for a social worker for the adoption unit, and $150,000 for an intercom paging system. Federal and state governments will issue $160,000 back to the county in reimbursements. The budget also contains $200,000 for additional staff to help with Medicaid expansion. Public Health received 2 additional environmental health specialist positions costing $151,000. The budget contains money to support up to 6% merit increases for employees and provides for pay plan adjustments to keep salaries competitive. Employee benefit for tuition reimbursement increases from $400 per year to $1,000 per year. A highlight among the county's special appropriations includes a $368,000 investment in TransAid, which provides transportation for persons with disabilities. Nonprofits receiving special appropriations include Experiment in Self-Reliance, Caladium, Neighbors for Better Neighborhoods, and the Arts Council. Tax rates for the volunteer fire departments serving rural areas remain the same at 39 cents per $100 value. The budget ordinance listed projects that could be paid for with PAYGO funds and are approved by county commissioners when the time comes include a handicap-accessible Yadkin River overlook at Tanglewood Park, a feasibility study on expanding the campground and considering potential campgrounds in other park locations, public safety center improvements, library branch upfits, and a Phase 2 of Blues Lake Park.
The budget was approved in June and went into effect July 1st. You can see a copy of the budget at forsyth.cc/budget. For Forsyth County Connections, I'm Ed McNeal.
Throughout the show, you see this, connectwith.forsythcountync.gov. You can go to that for all sorts of information about the show. And the episodes are on YouTube and all sorts of places, and I hope you'll check those out. We do want to thank the team here at Cable 2, especially TJ James, Kevin Wren, our executive producer, Ed McNeal, and Jeff Fabrizio for working on this production, and of course our county manager, Dudley Watts, for all his help. And for you, the viewer, I appreciate you sticking with us. We'll see you on the next edition of Forsyth County Connections.